let's go through some of the most prominent synovial joints in your body. So the first is the temporomandibular joint. So you can see we've got the temporal bone and then our mandible here, making up what we call our jaw joint. So this is often called TMJ. So this is a condylar joint where we've got that condyle here. Your jaw can obviously move this way as you open and close your jaw, but you can actually wiggle your jaw to the left and right. So this joint actually has two planes of motion. There are ligaments over here, like this joint capsule, that are going to help to keep the condyle in the socket so that it doesn't get displaced. One of the most common injuries to the temporomandibular joint is in males, typically on the left side of the face is the most often when this is displaced, and it's usually as a result of being punched in the face by another male because most people are right-handed. Another joint of importance is your shoulder joint, or the glenohumeral. So gleno is talking about the glenoid cavity of the scapula, and the humeral is the humerus. So this is where the head of the humerus inserts into the scapula. And you can see that there's a ton of ligaments surrounding here. And those ligaments help to make up what's called the rotator cuff. This is a common injury in like baseball pitchers where they damage their rotator cuff. And you can see that these are surrounded by bursa, those sacs of synovial fluid to help reduce friction. This is also a commonly dislocated joint. So if you drag somebody by the arms on the ground, it tends to pull the arm up above the head, and it's fairly easily to dislocate the shoulder from that way. So you should always be careful if you're like lifting small children by their arms, that you don't pull too hard on the arm. And if you ever dislocate a joint like your shoulder, which is most commonly dislocated, it's important to make sure you have a medical professional put it back in place, and they do that right away, because a dislocated joint puts a lot of stress on the tendons and the muscles surrounding it, and it can cause permanent damage if it's not fixed fairly quickly. But it's also important to make sure that it's fixed properly. So you can't just pop a joint back in without knowing the anatomy and how to do so safely. The elbow joint actually has two joints because your humerus is going to have a joint between the ulna and the radius here. So we have a humero-ulnar joint and a humero-radial joint here. And again, they're all wrapped in this joint capsule to help stabilize the joint. This is a typical hinge joint, and this is only going to move in one direction, right? So we move in this plane. So this is monoaxial. So you can move your arm, just do that right now, and flex your arm wherever you're at. And you can't really flex that joint in any other direction because this is that hinge joint. Another large joint is our hip. So this is called the coxal joint after the coxal bone, which is your hip bone. And this joint is going to happen with the acetabulum, which is that socket in the hip bone, and the head of the femur. When you look at just the skeleton, the acetabulum is a pretty shallow depression, but this head is very large. What actually happens is there's a labrum of cartilage that extends out from the acetabulum. So this labrum projects out and actually really holds the femur in fairly tightly in the hip joint, making it fairly difficult to displace. This joint is really important for stability. This is what we put all of our body weight on when we walk upright, is this hip joint. The knee joint might be everybody's least favorite joint. So again, this is two joints. So we have the tibiofemoral joint. So that's where the tibia and the femur are going to articulate. There's also a joint between the patella, so that's the kneecap, and the femur. So you can see that joint right here. The knee joint has a couple of tendons of note. So there's the anterior cruciate ligament, which is the ACL. And when you extend your leg out all the way, the ACL is very tight. And so this is commonly injured here when you hyperextend your knee. So if you're playing sports, it could be as a result of an injury. So this is commonly torn to tear the ACL. And it's usually repaired with surgery, where they typically will replace this with a graft from either the patellar ligament or hamstring tendon. You'll also notice that in the knee joint we have 2 meniscus. So those are the piece of hyaline cartilage on top of the tibia. So what you're seeing here is the looking down on the tibial surface. So you can see that meniscus right there and under here. And they don't go all the way through. There's actually bone exposed here. So part of the reason the knee joint becomes painful is because this meniscus doesn't cover completely, and it can wear away and start to kind of cause bone-on-bone interaction, which causes pain. The last joint we'll look at here is called the talocrural joint. So this is your ankle joint. It's named for talos, which is the tarsal bone, as well as crural, meaning this portion of the leg. And it's going to it articulates with both the tibia and the fibula, but only the tibia bears any of your actual body weight. And this is commonly injured. You have a lot of tendons here in the foot. So when you step on the tendon wrong or you injure the tendons in the foot, often we call that a sprain. So a sprain is any time you have injured a tendon but not actually broken a bone. And sprains can be just as painful as breaking a bone and often take longer to heal. So take a moment and choose one of these joints and try to describe it in as much detail as you can.